Welcome to the Shift Report, the podcast from MCentric and the MCentric Foundation. MCentric is the go-to information and resources hub designed exclusively for the emergency medicine community. We regularly host key leaders from the field who share their insights and experience. Our goal is to inform our listeners and to encourage you to use what you learn to improve your practice and improve yourself. To learn more, please visit us at mcentric.org. Today, we welcome Jon Handler. Dr. Handler lives and works in the Chicago area. He received a medical degree from the University of Illinois at Chicago and trained in emergency medicine in Washington, D.C. at the combined Georgetown and George Washington University's emergency medicine residency program. Jon was a medical informaticist before the term was in common use. Today, he'll talk with us about AI, big data, technology, and what our future might look like. Welcome, Jon.
Thank you, Till. It's great to be here.
And thanks for taking the time to share some insights about this important area. We hear all sorts of things about AI and technology and probably don't have enough time to explain everything to everybody, but you've been in the middle of things for a very long time, kind of before it was cool and a big field, and have a role now with a health system managing issues like that. So love to get your insights about that. Typically, what we'd like to do is sort of figure out how you ended up in emergency medicine, from whatever path got you there.
Sure. Actually, before we start, let me just get out of the way so that I feel better having said it, that everything I say is they're just my own opinions. They don't necessarily represent my employer or anybody else. And I'm going to say a million things that when I relook at this or re-listen to this, I'm going to say, wow, I made a mistake, or that was wrong, or boy, was that dumb, or that didn't come out the way I intended. So apologies already right off the front. And secondly, don't trust a word that I say. Double check everything. Treat me like untrustworthy AI. But with that said, how did I get into emergency medicine? I have my mom was a nurse. My dad was a doctor. They met, I think, when my dad was in residency at Michael Reese Hospital, which sadly is now defunct, and which I rotated through as a medical student. So what goes around comes around. And so I was really interested in the medical space. I actually thought about going into finance. I thought about going into computers and programming. I loved the idea of being able to help people. And I thought medicine was a really tangible way to do that. And I loved the idea of being able to handle as almost anything that would show up. And emergency medicine seemed like that path. And I probably also have a very short attention span. And I love the way emergency medicine caters to the breadth and variety of medicine. And I really loved the fact that in emergency medicine, we got to make the initial stab we got the first chance to make the diagnosis and the first chance to get the patient on therapy, whether it was life-saving or just helping them to get better. And I felt it was a little frustrating when I got patients after the emergency department that I very often felt like I was continuing the care that was started. And I wanted to be the person to launch that process. So emergency medicine seemed like a great fit, and it really was.
Great, thanks for that. Everybody's got a slightly different version of that story, and it's always good to hear how people ended up where they are. Now, you've practiced clinically, but also have steered yourself or got steered toward medical informatics broadly defined, which was not quite the same probably when you first started it as it is now. How did you end up with that combined interest, and did you have people, mentors, group of people who led you in that direction?
I did. When I was in college, when I was in high school, we had a programming course at a time when maybe there weren't many high schools that had one, and I really loved it. And then when I was in college, I was both pre-med, but I was also a finance major. And as part of my finance major, I had to take some programming courses, and I really liked that too. I almost went in that direction. Then I didn't really touch a computer during all of medical school. When I got to our residency program, as you know, Till, we had some of the world leaders in emergency medicine informatics at that program at a time, as you pointed out, when most people had never, including me, had never even heard the word medical informatics. And once some of those mentors, Mark Smith, Craig Fied, um, uh, Dr. Mark Smith, Dr. Craig Fiad, among others, once they said, "Hey, maybe you might want to do an informatics project with us," and I just started doing that work, I immediately knew that would be my life's passion.
That's great. It's great that you started even well before medical school and residency, but the field has now exploded and is continuing to explode. So I'd like to explore some of the specific issues and forgive my ignorance in the question asking on some of the terms and the uses. This is something that you've dug into in a very big way. So first, we hear a lot about artificial intelligence. You can't go to a conference now without hearing about AI. You almost can't go in the hospital without hearing about AI. In telemedicine conferences and otherwise, AI is mentioned in almost every talk. Tell us about your thoughts on AI, what it is, and in some cases, how we're using it without even knowing it.
Yeah, and this is one of my favorite topics. I'll go back again to our residency. I was so lucky that, one of my best friends and my the person that has most been my mentor throughout my career, Dr. Craig Fiad. Craig had us get BrainMaker, one of the earliest neural network pieces of software back when we were residents. So I still have the floppy disks and the instruction manual for that thing. And so we were really exposed at a very early stage, to some of the earliest work in AI. But really, at the end of the day, when you look at the definition of AI, and there's millions of different definitions, but many define it as the computer doing some of the cognitive work that a human would normally do. And so we have things like expert systems that are when a human says, well, under these circumstances, do this, and under these other circumstances, do that. And then we put that into code. That's considered AI by many people, and that was considered AI. We have algorithms that do that work. A calculator could be considered a form of AI, right? It's doing cognitive work that otherwise a human would have to do. And so what is interesting is that I feel like what seems to happen is every time there's a new advance in artificial intelligence, then people tend to redefine AI as meaning that new thing. And all the AI that came before wasn't, they sometimes treat as if it wasn't really AI, or they forget that it was AI. And so there's AI embedded in just about everything that we do. We may only be on audio, but you and I are looking at each other on video. The blurring that is automatically happening in the background, some AI is automatically detecting our head, our body. It's recognizing what is John and what is not John, what is Till and what is not Till, and it is blurring everything out behind us. And I will literally, be on meetings like this, where we have automated backgrounds, and people will be talking about what the world will be like in the future when we finally have AI. And my answer is, it's here. It's been here for a long time. And of course, we've had it in medicine for a very long time. We had automated, really pretty excellent EKG readings from back when we were residents, 30 or more years ago. And we forget that that's AI. Well, that's just so natural to see that we don't even kind of pay attention to. And then of course it gets an overread very often by a cardiologist, right? And we just forget that, the first version of that we saw came out of the computer. The cardiac monitors that we have, when those things beep because they recognize VTAC or, premature ventricular beats or abnormal rhythms and rates, that's AI that's actually reading the EKG and formulating a conclusion and generating an alert or for you. And that's embedded all throughout our devices. When we get an X-ray or an MRI and taking it to the next level. 3D reconstruction, that's AI taking these things and putting them back together and then rotating them for you and recoloring them and restructuring them. All that is stuff that, in the old days you would have to just reshoot the picture, so there is just AI everywhere in healthcare, and it feels to me like each time we get used to it, we forget that there's AI there, but it's there. And now we have new AI coming out, these large language models like ChatGPT and these things that will generative AI, automatically write things for you, automatically answer questions, automatically generate pictures, automatically write computer code. Really, really interesting stuff. And now people think of that as AI, and everything that else came before. Some people don't really recognize it as AI anymore. And that's just an interesting pattern. But we have it in healthcare. We'll continue to have it in healthcare. It's made a big difference. It's had a lot of benefits in healthcare. And I think we're going to see a lot more transformation as a result.
Great. You mentioned in that a relatively long list of innovations that may or may not be a version of AI, as you mentioned, but are something, whether it's generative AI, chat GTP or other technologies. And I believe you're correct. The EKG reading, you're right. We've all had EKG reading. It's not always accurate, which is why you have to look at it. But and that's probably true of AI in other areas too, where it's also not always accurate and ought to be checked. What do you see as the biggest technology innovations that are going to make a difference entering the field of medicine, emergency medicine in general, or just medicine?
Let me answer that after I just make one comment, and that is humans are imperfect and sometimes need to be checked.
That's
And
correct.
it is our hope that the combination of AI plus a human adds up to more than either one alone. And that's where the future looks exciting, just as the past has been exciting. As we go forward, I think the large language models first of all, let me just say this. Boy, predicting the future is really, really hard. Anyone who thinks, especially when technologies are evolving in an exponential fashion. So I often like to quote, I believe it was Bill Gates who said something to the effect of, the world will probably change less than you expect in the next couple years and more than you will expect in the next 10 years. And I think that's because as humans, we tend to think very often linearly, and I think it's commonly harder for people to think exponentially. So when you see something that was one and now it's two and now it's four, you tend to think that maybe the next one will be five, six, seven, eight. They start to draw a line, whatever it is, these numbers are small. But if you would actually extrapolate it out and say, well, those are actually doublings, right? And one becomes two, becomes four, becomes eight, becomes 16, 32, 64, 128, 256, 512. Pretty soon you're at 1,024, and you're like not that far out from when it was just one or two, going, oh my goodness, what happened? And what happened was that's the nature of exponential trends. If that's what we're seeing here, and it feels like it is, and I've seen some data to suggest that's what it is, then a lot of what we're experiencing now may get unexpectedly and dramatically better and more powerful in the coming years. And so as transformative as some of these technologies look to us today, they'll be hopefully even more transformative and more beneficial than we can potentially imagine. At least I hope that's the case in the upcoming years. So I think the generative AI stuff is interesting because it has the potential, for example, we see some use cases around using generative AI to help to just listen in on the clinician's conversation and just automatically create a first draft of a note. So that's different than speech recognition, which is another form of artificial intelligence that we've had, right? And in fact, I remember back in our residency days that we had one of the very earliest versions of speech recognition documentation into an electronic health record or into any form of a health record. And that really advanced a lot over the last few decades. But now we have technology where you don't even have to do anything specific to document a note. It just happens automatically. And that has the potential to have real time savings for physicians. I don't know about you, but I never really enjoyed writing up the chart. I liked seeing the patient. I liked giving the therapy and the care. The writing of the chart was not the part that was I look forward to every single day. And if something could do that on my behalf, that would be wonderful, especially if that gave me more time to care for patients and treat patients. I mentioned that humans are imperfect. If we had AI that could help us to more often make the correct diagnosis, more often get to and more quickly get to the correct therapy, to help us provide that therapy and to help us in all the ways that it means to be a great clinician, that would be wonderful. And better testing, better imaging, better tests, better algorithms that drive our sensors. All these things can feed into our decision making so that we can do an even better job for patients than we do today. And at the end of the day, I think that's what is exciting about medicine in general, and what gets us up every day is to go out there and help people. And if this helps us to do a better job of that, that's an exciting world to go into.
That's a great insight. I recall as you talk about documentation and how difficult it can be, and it's not really what people want to do. I recall an illustration from a book you may well have read called The Digital Doctor by Bob Wachter. So if you haven't read it, or if other listeners haven't read it, it's a very interesting take on what can and can't happen related to technology. But the illustration is a drawing that had been sent by a child to his pediatrician as a recounting of his visit to the doctor. And the child is sitting on an exam bed. The mom is sitting in a chair beside the bed, and the doctor is faced away from the child looking at a computer screen typing. And that's the child's recollection. And I think we can probably do better than that. So that kind of brings us to a topic that always comes up in a technology discussion, and I'll be interested in your thoughts on it, which is electronic health records, or EMRs or EHRs. And whenever you mention this to most physicians, their shoulders slump and they might groan, and they have kind of a love-hate relationship. They kind of forget what it was like when it was just paper, but which was not good. But it's you're sort of universal complaining about AHRs or EMRs and how they work. In your view, what's the truth about electronic health records, and how will they improve over time?
I think electronic health records are an amalgamation of a whole bunch of functions. And so when we talk about electronic health records, we're kind of taking an average general feeling about a lot of different things. And my personal opinion and my guess is that very few people are dying to go back to the days when results lookup was entirely on paper. And if you would get the result, it was on paper. If the paper got lost, you were in trouble. If you wanted to see a prior version of this thing, you had to go up to medical records physically and get a whole bunch of paper and look through all the paper. When it comes to getting information back out of the electronic health record, I think it's been an incredible unmitigated, I don't want to say unmitigated, because I don't like to make anything an absolute. But I think it has been a big success. I think digital radiology, big success in terms of how much better it is from a clinical experience from my end anyway, from what we used to have to do when we had those plastic physical sheets that we had to put up on the light board. And so when it comes to getting data out, I think it's been a big help to us. We have access to a lot of data. Some people can feel overwhelmed with how much data there is. On the other hand, it's easier to work with, it's easier to find stuff, it's available, much more available than it ever was before. And I think that's an important part of great care. I suspect that much of the feelings that you were describing relate to the data input part of the electronic health record. And some of that historically has been, maybe a lot of that has historically been driven in part by the need to documentation-based billing. And so some of this doesn't fall on the EHR, it falls on the environment into which the EHR lived. And so this is where, for example, I think some of these new technologies have the potential to take some of the things that people may be less excited about with their electronic health record and make them better. And so I think that's a really exciting thing. There's lots and lots of great things that have come out of having electronic health records. And some of them have been at the cost of additional, well, not necessarily at the cost of, but we have also added additional work to clinicians in terms of where and how they document. And now we have technologies coming aboard that may mitigate that. So I think people may feel differently than what you're describing as we go forward if these technologies are successful. So exciting time.
Great point. I think, as I'm thinking through this and you talk about x-ray boards, I think there has been a significant skill loss among residents and young faculty at this point because nobody knows how to throw a plastic x-ray at the board and get it to stick like you used to have to do. So that was
Right.
that nobody has.
Quickly, you can get a CAT scan to be oriented in the right way when you put 5 of those sheets up on the board.
Right, right. So some things that we forget are certainly big improvements. So that's good points. So the future, you've already said, and I would agree, predicting the future is a difficult task, but we get asked to do it all the time. So what would you like us to know, and what would you like physicians to know, or medical students, or anyone else about the future of data and technology in medicine? And I think it sounds like you're an optimist, and I know you to be an optimist. So what's coming, and what's going to make our lives better and our patients' lives better?
Well, in no small part, thanks to the electronic health records you were talking about, we now have an incredible amount of data that has been digitized and is available to us now for research to help us to learn how to better care for patients and to see what works and what doesn't work. We now have these large language models that have the potential in this generative AI and these new artificial intelligence technologies that allow us to potentially unlock data that was much harder to get at in what we call unstructured data. So when you click on a checkbox or something, we call that structured data, right? Are you left-handed or right-handed or ambidextrous and then when you pick that, that's easy for us then to say, show me all the patients who are left-handed. When we document that in free text in your clinical note, it's harder to pull that stuff out, right? The patient is not left-handed. You can't just look for the word left-handed. You have to wait, they're not left-handed, so they're maybe right-handed or maybe they're ambidextrous. So now we have these large language models that can automatically pull some of that information out maybe more easily and successfully than we've been able to do in the past. We've got these algorithms now that can automatically analyze images to help us do a better job in recognizing, when there's a problem on an image. And even simple things, just putting an image that an AI thinks has a higher likelihood of having a really bad finding on it, like a brain bleed or something, up to the top of the priority list for a radiologist to read, or sending an alert about that so that somebody can see earlier rather than later that the patient's got, really concerning condition. So we now have data available to us to drive this kind of research, to drive this kind of development so that it creates what I think will be hopefully a virtuous cycle in which we have better technology to analyze that data. We have more data available to feed that technology. And the outcome of that hopefully will be rapid development in terms of artificial intelligence that helps us provide better care for patients. And that helps us to reduce burnout among clinicians, which we know is a big problem. So if we can do a better job of helping patients than we already do today, which I think we do an amazing job today, and I also think we have potential to do even better every day. And if we have the potential to provide better service for patients, a better patient care experience, a better clinician experience, the medicine of the future may be substantially more fun and more satisfying than it already is today. And the patient experience may be more positive and in line than what many of them may experience today. I don't know many people who look forward to going to the emergency department, and nobody probably ever will, because if you're going to the emergency department, something's probably happened that isn't optimal. On the other hand, many people I know are afraid to go to emergency departments because they're afraid they're going to get stuck in the waiting room for a long time, and we know that has been a problem. If artificial intelligence in partnership with great clinicians allows us to see patients faster, to more give them a better chance of getting a correct diagnosis right off the bat, as opposed to, for example, just saying, well, I'm not sure what this is, but at least I know it's not something bad, which sometimes we're obligated to do, because we can't always get the right the exact diagnosis right off the bat. Maybe we can do that more often. Maybe we can get patients on the correct therapy even more often than we already do. So in just every way, I'm hoping that that's what the future holds for us, and that some of that will be enabled by artificial intelligence. Now that's what I'm hoping, and that's a prediction. But like I said from the beginning, you shouldn't trust any predictions I make. 5 years from now, there's two things that will probably happen. One is here's a prediction I'll make, knowing it's at risk. 5 or 8 years from now, when we get together, things will be a lot different. There will probably be a lot of things that are better for patients and a lot of things that are better for doctors. And we will probably not, we'll probably take a lot of it for granted until we turn back and look and remember what it was like 8 years ago, just like we do now, right?
Right.
We say how tough it is now. Then we look back, what was it like 30 years ago? And that was pretty tough too. I don't think anyone's running to go back to paper records and plastic X-rays. Um, and I think we'll say the same thing 8 years from now. There'll be things that get better, and of course, that will lead to some things that are more challenging.
Yeah, those are great insights about technology, and we could go on for a long time. And you have had, and we will certainly link in the show notes of this some of the other discussions you've had with others, which are fascinating. So thank you for continuing to advocate for this. One thing you mentioned is making, I'll paraphrase, making this fun and satisfying, which I think many emergency physicians and other physicians and other providers wouldn't say is the case in medicine right now. And you mentioned burnout, which is a big issue. From a data technology, making the workplace better perspective, what are your thoughts on how the areas we've been talking about can help with the problem of burnout, which is growing rapidly?
Well, we talked about ways that that reducing what they call pajama time, where you're doing work and documenting, long after your shift has ended, maybe when you're in your pajamas, and and we've talked about, or even when you're working, how you can then spend more time doing the things that I think most of us went into emergency medicine for, which is to have an human to human interaction that's meaningful, for both the patient and the clinician. And hopefully, as technology fades into the background and becomes more of an enabler as opposed to something that we're interacting as much with the technology as we're interacting with the human, and we feel that, as that becomes more of a human to human interaction and more of a successful human to human interaction, I think that will make the process of emergency medicine even more satisfying than it is today. And hopefully that'll be an important area for reducing burnout. I also think that, as we have some of these technologies that help support patients outside of what happens when we send a patient home? I was stressed out. What happened to patients if I admitted them, if they went home? I worry about everybody and all the time and everything. And if we have artificial intelligence and technology that helps patients throughout their entire process of care, whether that happens at home, whether that happens in an inpatient setting or anywhere else, the greater confidence we have in the entire process of care, the more we can enjoy our part in that process. At least I'd like to think that that's true. And I'm hoping that AI can be a help with that. The challenge of shortage of clinicians is a real problem, and how do we help have artificial intelligence help us to address that? I think there's real opportunity there, and some of it may be helping us to see patients more quickly, to make decisions more quickly, to get the information we need to make those decisions correctly and appropriately, and to do that faster. All that can be really, really helpful. I mean, think of the days before you had rapid CT. If the time it takes to get a CAT scan now compared to the time it takes to get a CAT scan, years ago is a lot less. That shrinks the time that it takes to see a patient, and that means we can have more patients coming through the system, and we can get they're happier and we're happier. So I think there's just many, many ways in which advances in technology will hopefully help to address the issue of burnout and to make emergency medicine continue to be a really satisfying specialty.
That's a great positive message. Thank you for that. And thanks again to Jon Handler for demystifying the data and technology world for all of us. We appreciate your time today. Thank you, Jon.
Thank you, Till.
And thank you for joining us in this installment of our M-Centric Shift Report podcast series. And special thanks to Dr. Jon Handler for sharing his important insights.